Hello, my name is Paula Anderson, and I am with Paula Anderson Coaching and Consulting, which is a company that offers continuing education for healthcare professionals, specifically medical coders, medical billers, and then we also have a non-clinical continuing education program for licensed massage therapists. This lesson today is going to be over surgery coding. So this is designed for individuals that are getting ready to prepare for the CPC exam. So I'm going to go over some of the concepts related to CPT and the Global Surgical Package. So if you look at your 2022 CPT manual and you look at your guideline pages, you will see these elements listed. And what I'm going to do is just go over a few of them so that you have a good understanding of what they are. So local infiltration, metacarpal, metatarsal, digital block, or topical anesthesia. So anesthesia that's considered to be local is not a billable service separately, so it has to be included in the actual procedure. Subsequent to the decision for surgery, one related E&M encounter on the date immediately prior to or on the date of the procedure, including history and physical. So what this is referencing, when a patient is going in for a surgical procedure, they're going to have an evaluation management related service, but that service is not going to be billed because it is going to be bundled into the actual surgery that's going to take place. Immediate post-operative care, including dictating operative notes, talking with family and other physicians. So this is for uncomplicated problems that occur. So as long as it is related to the aftercare, then it's going to be bundled into the surgical package. Writing orders, I think that's pretty self-explanatory. And typical post-operative follow-up care, again, that's the same thing as making sure that whatever the patient is experiencing that's related to the surgical procedure, there's not going to be a billable charge for that. But there is a CPT code that can be used to document that that patient came in for a service, and that code is 99024 in the medicine section. Now let's talk a little about the difference between major versus minor procedures. So major procedure has a 90-day global period, and the example that I have on the slide is a breast mastectomy. And what you can do is you can pull up your Medicare administrative contractor, and it will give you the option of actually entering in the CPT code so that you can get what the global days are. So minor is for 0 to 10 days. So you have an example here of a colonoscopy. Now I have these two modifiers listed on the slides because one is related to a major procedure being performed, and then the other one is related to a minor procedure being performed. And I have a separate lesson that talks about the modifiers. So we're not going to go too much in detail with that. Now, your surgery consists of 3 components. So you have your preoperative, your intraoperative, postoperative, and your preoperative, of course, is before the surgery is done. And then the intraoperative is when the surgery is being performed, and then your postoperative care when the surgery has been completed. Now, on the reimbursement side, everything that's done that's related to that surgical procedure is going to be bundled into one payment. The only services that are actually separately billable are those where the patient has to return to the operating room because of some type of complication. And there is a modifier that is required for that, and it's going to be modifier 78. Diagnostic procedure versus therapeutic procedure, which indicates when you come in for a diagnostic procedure, you're actually trying to determine what the problem is, versus once you know what the problem is, then it becomes if there's going to be any kind of correction made, then that's going to be considered as a therapeutic procedure. So if you take a procedure such as a colonoscopy, which is diagnostic, but if they remove any kind of polyps or if they do a biopsy, then it becomes a therapeutic procedure. Now, one of the terms that's in the CPT manual that sometimes is confusing to individuals is the separate procedure. So the definition of separate procedure is in your guideline pages as well. So what you want to do is you want to read that and get a good understanding of what a separate procedure is. So separate procedure is a component of a larger procedure. And how do you know if it's a component of a larger procedure? Then in the CPT manual, you have the word separate procedure in parentheses, so that gives you an indication. But you also have your CCI edit. So you can go to the National Correct Coding Initiative website, and it has a listing of all the CCI edits based off of the chapter. And you can find out what codes are bundled using those CCI edits. So I highly recommend that you do that. Now I have modifier 59 on this slide because when you have a separate procedure and it needs to be billed separately, meaning that it is a procedure that was done distinct of other procedures, then that's when we'll add modifier 59. Now that takes us to some of the surgical modifiers. So I'm not going to go over each one of these modifiers because I have a separate lesson on the modifiers. But what I will do is just kind of cover a few of them just so that you can have a good understanding. So when you're getting ready to prepare for the CPC exam, and the surgery section, of course, is the most comprehensive. One of the things that I recommend is that you actually create index cards so that you can learn the modifiers and know their application, so that when you're actually reading an operative report, you can figure out what the physician is doing and if a modifier can be applied to that situation. So let's use modifier 50. Patient had a breast mastectomy, and of course they did the right and left breast. So of course modifier 50 would apply to that. Patient had elevated blood pressure and they decided to cancel the procedure. So because the patient's health was being threatened, that's going to be modifier 53. Patient had infection from a previous surgery that was done within the 90-day global period. So they're going to have the patient come back in and they're going to correct that, and that's going to be modifier 78. So you can see how the modifiers actually affect reimbursement. And these are modifiers that affect reimbursement. And if they're not applied correctly, then of course the physician will not get paid accordingly. Now, coding an operative report. So an operative report is the documentation that a surgeon dictates once he has done a procedure. And these are the elements of an operative report. So you have the preoperative diagnosis, which is the diagnosis before the procedure was done. Then you have the post-operative diagnosis, which is the procedure, the diagnosis after the procedure. And then you have the anesthesia, whether that was general anesthesia, regional anesthesia. Those are the anesthesia types that are actually billable. Then you have the surgeon's name, the procedure name, and then the procedure details. So what I recommend for individuals who are preparing for the CPC exam is to make sure that, first off, you know the procedure that's being performed. Then make sure that you know the anatomy of the procedure, meaning that where on the body are they. Then you need to look up all vocabulary terms that you do not understand, that are not familiar to you, so that you can really understand what is being done. And then analyze the report from the beginning to the end so that you'll know exactly what they did when they started and what happened when they finished. Now, in between that operative report, you need to be thinking about what procedures are billable and what procedures may be bundled. And this is where the CCI edits come into play, because you need to know when something is bundled into a procedure, because you can't bill for that separately. So that concludes this short lesson on surgery coding. I do have a workshop that's coming up on Monday. It's a live workshop where I'm going to be going over surgery coding, and it's designed for individuals that want to learn a little bit more, but also you want to be able to ask questions. And we can do a few examples, and we're going to cover the CCI edit. So if you would like to join that, then of course you can go to my website at paulaandersononline.net, paulaandersononline.net. I look forward to working with you. You can sign up for one of our coding refresher sessions, or if you need continuing education, you can sign up for that. Thank you.